My name's Alison Duffel. I'm one of the community nurses working in the Department of Neuropsychiatry. My role in the HD multidisciplinary clinic is to support patients and carers who have diagnosis of Huntington's disease, to follow them up at home so that we can offer support and monitoring of their well-being, look at things like medication changes and help to direct people towards other services who may be able to support them as their needs change and potentially their needs increase.
Hello, my name is Karen Smith. I'm a nurse on Ward 5 at the Harplands Hospital. Ward 5 is a neuropsychiatry ward and with the inpatient facility in neuropsychiatry. Neuropsychiatry looks after people with Huntington's disease, early onset dementia, people with following head injury and epilepsy. We're part of an integrated team and work closely with people in the community and daycare services and other members of the multidisciplinary team in order to assess patients with Huntington's disease. Huntington's disease is a very complex illness. Because of the disease process, it takes involvement from all the members of the multidisciplinary team to assess the biological, psychological and sociological factors that are affecting people with Huntington's disease and the best ways of addressing these problems that they're experiencing, working closely with the family and other community services to provide the best type of care that we can for the people in our care. Hopefully most of our people go back into the community with either a package of care or sometimes they require long-term care, but quite often just a short spell in hospital and inpatient services, looking at problems that people are experiencing and ways of addressing these can mean that they can stay at home for a lot longer and thus improving the quality of life of these people.
My name is Lynn Hollins and I'm the Day Service Coordinator. The service currently offers 2 dedicated days to individuals with Huntington's disease. The service aims to support the complex needs of the individual on both a group and individual basis. Various therapeutic stimulating activities are offered which enable the skilled team to assess and monitor the progression of the disease, focusing upon effective symptom management and education. Changes and a deterioration in symptoms are often recognised quickly and an appropriate management plan implemented.
We tend to work quite closely with the Huntington's Disease Association. We hope that we'll continue to work with carers and patients, but we would like actually to see our other organizations as well getting involved. Social services will need to recognize the condition a bit more, sometimes it feels. And we have recently launched a support group for patients, actually not necessarily patients, for young adults who are coming from HD families. They are either affected by the disease themselves, they may carry a positive gene, and they will have to live with all the uncertainties around this. They may have witnessed a parent who's fading away by the condition, and this group actually don't have enough support at the moment. So we met with a couple of young adults, the representative from the Huntington Disease Association and some professionals, and this will be launched quite soon. We also would like to continue working again with patients and carers and educate even the public because of the well-known stigma with Huntington disease. And we would like to help people to live a life that they can enjoy and just hold their hands along the path for the whole journey, really. The actual service is regarded very highly by trainees locally and regionally as well. So people will come to our multidisciplinary clinics where patients will be seeing a number of professionals. Training finds it quite useful. We also supervise trainees from other departments, rehabilitation medicine, neurology, other disciplines, social services or nurses, junior nurses will be coming along as well. And they find the experience quite enlightening because of the nature of the disease and the service we offer. We tend to present ourselves in different events, nationally and internationally, and the idea is to be exposed to some form of mutual learning, really. We learn from other services, and we try to share any successes or any concerns that we may have, and we discuss those with colleagues. We did a number of publications trying to address GPs and other primary care providers, educate them on what Huntington disease is like. We also published a booklet to carers just to help them to understand the nature of caregiving difficulties and how they can cope with that. We are part of the European Huntington Disease Network, and our site is a recognized site for this particular organization. So we tend to work with a number of other agencies and national as well as international organizations.